to say that it's an honor to introduce very talented neurosurgeon, Dr. Ammar.
This is a unfortunate younger gentleman. He's 28 now, I believe. He was involved in a motor vehicle accident in 2004, had his fracture dislocation with the Asia A spinal cord injury. He was treated by one of my senior partners with this fusion. I wanted to show this because he had no coronal deformity, he had no scoliosis at this time. He was completely paralyzed and remains so. And over time, I first saw him in 2018, he had developed this C-shaped curve consistent with neuromuscular scoliosis consequent to his injury. When I first saw it, I thought, we're just going to manage this conservatively, given the circumstances. But he, increasingly, really exponentially over the next 12 months, began to have pain associated with this that we really felt was associated with this angle here, particularly the ribs and its association with this dramatic pelvic tilt that he had developed. So I felt like he would get a good benefit from intervention, and elected to use the MiRus system on this. I thought he was a very good candidate for it, and that's what we did. We got this down to about 30 degrees, sagittal alignment. Clinically, he's just done outstanding. He feels just clinically so much more upright that he's thrilled. Not dramatic here, but I was happy with this. I didn't do osteotomies or really go for the gusto here in terms of trying to do anything too Herculean. Really just instrumented and let the rod do the correction for me here, and got an excellent correction. One of the things that we did in this case, and I was really excited to have the opportunity to try this, was use the Galileo sagittal alignment system. And so I think this is a very promising and exciting technology that we're going to be able to increasingly utilize to understand what we're achieving intraoperatively in regards to our correction of whatever the sagittal plane deformity is that we're trying to address, whether it's trying to match lumbar lordosis to pelvic incidence, whether it's correcting a kyphotic deformity or global sagittal alignment. We're looking at ways to quantify that and provide real-time data to give us information that lets us understand what the maneuvers we're doing have accomplished to get the best possible outcome. What you'll see is that there are sensors here. They've given these the name OSMs, which is OSM, or orientation sensing monitors, that are attached to this device, which really is like a Caspar pin, which was placed in the spinous process. That may evolve to something a little bit more stable over time, but right now that's what we've used in this case. And then through some intraoperative films and their registration with the system that they have, we're able to get a sense of what the initial angles are, and then how much correction we are getting through what we've done surgically. I think that this is really going to be a true value adder in providing a more accurate way to quantify quantify those measurements compared to anything that's out there right now. So stay tuned there, but definitely a very exciting technology that I think is going to be applicable whether or not you're doing a 2-level degen fusion someday, or a bigger construct like this.
Thank you again, Dr. Ammar. Continue to stay safe during this COVID times.